Hi, my name is Jessica Cabral. I am in Indiana State University distance online nursing program. This presentation is for my community health nursing class, and today I'll be talking about sleep. Before we continue, I'd like for you to take a pause and click on the link in the description for a short quiz before we begin. Before the end of this presentation, the learning objectives that will be shared and discussed are regarding the physiology of sleep, ideally how long one should sleep, what the main functions of a good night's rest will accomplish, and a couple of different types of sleep disorders. Sleep is naturally a recurring state of mind and body, an important part of the daily routine. Without sleep, you can't form or maintain the pathways in your brain that let you learn and create new memories. And it's harder to concentrate and respond quickly without sleep. More than a third of US adults report lack of sleep less than 7 hours each day. There are two types of sleep: non-rapid eye movement sleep, or non-REM sleep, which has 3 different stages, and Rem sleep, which is rapid eye movement sleep. Each is linked to specific brain waves and neural activity. In stage 1 of non-REM sleep, it's the changeover from wakefulness to sleep. You spend about a couple minutes here before you move on to stage 2, which is a period of light sleep before you enter the deeper sleep. You spend more of your repeated sleep cycles in stage 2 than any of the other stages. And finally, in stage 3, non-REM sleep, it's the period of deep sleep that you need to feel refreshed in the morning. With REM sleep, it first occurs about 90 minutes after falling asleep. There is no magic number of sleep hours that works for everybody in the same age. Most adults typically need 7 to 9 hours of sleep at night, but after age 60, nighttime sleep tends to be a little bit shorter, lighter, and interrupted by multiple awakenings. According to Wheaton and Clausen in the Morbidity and Mortality Weekly Report of September 2021, infants and children and adolescents who do not get sufficient sleep are at increased risk for adverse health outcomes. Most adolescents report sleeping less than the recommended amounts. During 2016 to 2018, approximately 1/3 of children ages 4 months to 17 years slept less than the recommended for their age, particularly those from racial and ethnic minority groups of low socioeconomic status and those with special health care needs. The CDC recommends and suggests that 18 to 16-year-olds should have about 7 or more hours of sleep per night, as I previously stated. And again, as this age increases, the proposed hours of sleep actually decreases. Here you'll note on the table that toddlers from 1 to 2 years should have about 11 to 14 hours per 24 hours, and that includes naps. Everyone dreams. You spend about 2 hours each night dreaming, but you may not remember most of your dreams. Its exact purpose isn't known, but dreaming may help you process your emotions. The circadian rhythms direct a wide variety from daily fluctuations in wakefulness to body temperature and metabolism, and the body's biological clock is based on roughly a 24-hour day. The sleep-wake homeostasis keeps track of your need for sleep. Factors that influence your sleep-wake cycle needs include medical conditions, medications, stress, sleep environment, and basically what you eat and drink. When people struggle with insomnia, sleep hygiene is an important part of cognitive behavioral therapy, the most effective long-term treatment for insomnia. This helps address the thoughts and behaviors that prevent you from sleeping well. It also includes techniques for stress reduction, relaxation, and sleep schedule management. To develop some healthy sleep habits, you want to be consistent. Go to bed at the same time each night and get up at the same time each morning, including on the weekends. Set a schedule. Go to bed and wake up at the same time each day. You want to try to avoid caffeine and nicotine late in the day, and try not to drink any alcoholic beverages before bed. Don't lie in bed awake. If you can't go to sleep, do something else, like reading or listening to music, until you feel tired. Smart technology can record sounds and movements during sleep, journal hours slept, and monitor heartbeat and respirations. Using a companion app, data from some devices can be synced to a smartphone or tablet or uploaded to your computer. Other apps and devices make white noise, produce light that stimulates the melatonin production, and use gentle vibrations to help us sleep and wake. As previously discussed, one of the disorders for sleep is insomnia. Insomnia is characterized by an inability to initiate or maintain sleep. It may also take the form of early morning awakening, where the person awakens several hours early and is unable to fall back asleep. Healthcare providers may treat chronic insomnia with a combination of sedative hypnotic or sedating antidepressant medications, along with the cognitive behavioral therapy techniques to promote regular sleep. Obstructive sleep apnea is more than just snoring. It may be a sign of sleep apnea. Persons with sleep apnea characteristically make the periodic gasping or snorting noises during their sleep, which interrupts their sleep cycle. Treatment depends on the cause. Consider talking to a healthcare provider. The American Academy of Sleep Medicine recommends an annual obstructive sleep apnea screening for all adult patients who have heart failure, elevated blood pressure, AFib or atrial fibrillation, resistant hypertension, type 2 diabetes, and stroke. In addition to the increasing risk of numerous health problems, insufficient sleep is associated with increased errors and greater risk of both workplace and motor vehicle accidents. It's also associated with higher rates of absenteeism from work and reduced performance while at work. So developing some good sleep habits are. So for more information on resources, I'll post the links to the sleepeducation.org website that has a lot of good information on there. The CDC website also provides some good sleep resources. Before you leave, go ahead and click on that link in the description for that short quiz that we took previously before beginning the presentation. And here are some of the references that I used in this presentation. Thank you for your time.